name is Ashley Neal, and I'm a family nurse practitioner student at United States University. And I've got Matt here, who's agreed to help me with the musculoskeletal assessment. Matt, do I have your consent to upload this to YouTube as I'm listed for my professors to grade and view?
Yes.
Perfect. We're going to get started. First off, by me washing my hands. First, we're going to start with the fingers, and like with anything, we're going to start with by just first inspecting. We're going to be looking for any nodules. We're going to be looking for symmetry. I'm going to be looking for any atrophy. I'm going to be looking for any rashes, any visible deformities that you might have. So I'm just going to start. I'm going to be inspecting the hands and the fingers, and then I'm going to start by palpating. So I'm going to palpate the first the distal interphalangeals. Perfect. Distal interphalangeals and the proximal interphalangeals. And I'm again palpating for any tenderness, any swelling, any crepitus, any fluid that there might be. And then I'm going to do the meta interphalangeals. And I'm again going to be palpating for any crepitus, any tenderness, any swelling that there might be, any deformities, any nodules that felt, and those feel great. So next we're going to start with do range of motion. So I'm going to have Matt make a fist. Perfect. And then we're going to do, we're going to extend our fingers, and we're going to flex our fingers, and we're going to adduct our fingers, and we're going to adduct our fingers. Perfect. Next we're going to go on to wrists. Again, I'm just going to start wrists by inspecting. So first I'm going to inspect the wrists. I'm looking for any deformities. I'm looking for any swelling. I'm looking at symmetry. I'm looking at any atrophy that there might be. I'm going to inspect for any deformities that might be obvious. And then I'm going to inspect the metacarpals. And again, or palpate, and I'm looking for any crepitus, any nodules that might be felt, any swelling, and then I'm going to go on to the carpals. Is there any pain or tenderness with that?
No.
Perfect. Next, we're going to go on to range of motion with the wrist. So for range of motion, I'm going to have Matt flex his wrist. Flex your wrist. We're going to extend your wrist, and we're going to adduct the wrist, and we're going to adduct the wrist. So for the wrist, we're going to do two tests, and for the test, we're going to do the Tinel sign. So for the Tinel sign, I'm going to have Matt hyperextend his wrist, and here on the medial nerve, I would tap, and if there was any pain, paresthesia, any numbness, normally down into the second or third and fourth finger, that could be a sign of carpal tunnel. And again, I would do it here. On the other hand, have Matt hyperextend his wrist, and I tap there on the medial nerve, looking for any paresthesia, pain, any numbness, usually in the third or fourth finger. The next is called the Felon sign. So I will have Matt hyperextend his wrist, and I will have you kind of push them together. Matt would hold that for 40 to 60 seconds, and any sign of any paresthesia or pain radiating down into his hands or fingers could also be a sign of carpal tunnel. Perfect. Thank you very much. Next, we're going to move on to the elbows. Again, with the elbows, we're going to be inspecting for any nodules, any abnormalities you might have. We're going to be looking at symmetry, any swelling that there might be. And then we're going to move on to palpating. And then we would start with the extensor surface of the ulna. And I'd be palpating here, looking for any pain or tenderness. And then I would move on to the olecranon process, which it would be the elbow. And I'd be looking for any crepitus, any pain or any swelling with that. Perfect. And then I would move on to the lateral epicondyles, and I would be palpating here. And for the lateral, you would be looking for tennis elbow. And then I would move on to the medial. And for the medial, I'd be looking for golfer's elbow. So any pain, any crepitus, any tenderness with that could be a sign of either tennis elbow or golfer's elbow. So next we're going to move on, and we're going to go to range of motion. So for range of motion for the elbows, I would have Matt first off start out by extending. Perfect. And then you're going to flex, and then we're going to pronate, and then supinate. Perfect. Did you have any pain or tenderness with that?
No.
Great. Next, we're going to move on to the shoulders. Shoulders, again, we're going to start with inspecting. And if we were in a clinic, I'd have Matt in a gown so that I could inspect visually his skin and be able to see if there was any deformities, any rashes, I would be looking at symmetry of his shoulders. I'd be looking and inspecting his posture. I'd be looking for any deformities and anything that might be abnormal. And so then next I move on to palpation. So I'm going to start with a acromial clavicular joint. So I'm going to palpate from the clavicle out to the acromion clavicular joint. And then I'm going to move on to the deltoid bursa. I'm looking for any pain. And then down to the tubercle of the humerus, the greater and then the lesser. And then I'd be going down into the bicep groove. Right. And then I'd be going on to the coracoid process. Perfect. Again, as I'm palpating, I'm looking any for pain, tenderness, any swelling, anything that might be abnormal, any nodules that I might feel. Next, for the shoulders, we're going to do range of motion. So I'm going to have Matt extend, or flex, sorry. We're going to flex, and I'm going to have you go back for extend. And then we're going to do abduction, arms out. And for adduction, I'm going to have you move your arms in front of your body. Perfect, with your right arm. And then over with your left arm, we're going to go. And then we're going to do external rotation and internal rotation. Perfect. For the shoulders, we're going to do a test called the empty cans test, and that's just looking for supraspinatus strength. It also could be a sign of a rotator tear cuff. So I'm going to have Matt put his arms out like he's holding the can. And you're, sorry, excuse me. And then I'm going to have you turn the can upside down. And then I'm going to just push a little bit on his arms. And if one of his arms fell or there was pain, it could be a sign of a rotator cuff tear. Sorry. Perfect. Was there any pain with that? Awesome. Next, we're going to move on to the head and the neck. I'm going, again, just going to inspect, looking for symmetry of his neck, looking for any nodules. I'm looking for any tenderness or any swelling. I'm going to assess the symmetry of his neck. And I'm going to start first just by palpating his TMJ. And I'm going to be putting my two fingers in front of his tragus, and I'm going to have Matt open and close his mouth for me. Perfect. There's no clicking. There's no extra popping with that. And I'm going to have you turn your, actually at this point, I'm going to have you try to put 3 fingers into your mouth. Great. Perfect. And then I'm going to have you do your jaw side to side. Move your jaw side to side. Perfect. Was there any pain or clicking with that? No. Awesome. Next, we're going to move on, and I'm going to start palpating. I'm going to palpate a sternoclavicular. And I'm going to be palpating, and I'm going to be feeling for any crepitus, any swelling, any inflammation that I might feel. And then I'm going to move on to his cervical spine, which starts about C1 down to C7. Again, I'm going to be just looking for any step-offs, which could be an indication of a herniation of his disc or any bulging. So I'm just going to be going down to C7. Perfect. Did you have any pain with that at all? And then I'm going to be assessing, palpating his paracervical muscles, which are the front of his neck and the back of his neck. So I'll just be palpating that again for any inflammation, any swelling, any crepitus that he might have. And then his trapezius. Maybe I'll have you stand up so I can show you what trapezius are. Trapezius are right here on Matt's back. So I'm going to be palpating that again for any inflammation, any pain, any crepitus that he might have. And then I'm going to palpate his rhomboids, which run right here across his back, the greater and the lesser, or the major and the minor. Rhomboids. Perfect. Did you have any pain or tenderness with that?
No.
All right. For his head and his neck, I'm going to have, you can go ahead and sit down so we can see you here. I'm going to have you flex your neck. We're going to have you look down. And I'm going to have you extend your neck. And then I'm going to have you turn your head to the right and then to the left. And then laterally, we're going to have to touch your right ear to your shoulder. And then left ear to your shoulder. Do you have any pain or tenderness with that? No. Next, we're going to do the Sperling's test. So for this Sperling's test, it's going to check for cervical radicular pain, paresthesia. I wouldn't do this on Matt or somebody who was elderly or frail. Sorry, I think my screen just clicked off. Elderly or frail. So I would have Matt turn to the side and I would stand behind him. Yeah, that's great. And I would just have you tip your head to the side and I would take my hands and I would press down on that. And if there was any pain in the spine, it would be a sign of injury to his cervical spine. So again, I wouldn't do that if he was elderly or frail. Just gonna make sure my screen doesn't turn off. Okay. Next, we're just gonna move on and we're gonna start with the feet and the toes. So I'm gonna have you lay down. Perfect. So first off, I'm gonna be assessing from flat feet here with Matt's feet, and then I take three fingers and I would put them underneath the arch of Matt's foot. And if I couldn't fit my 3 fingers under there, it'd be a sign that Matt has flat feet. And I'm just, along with inspecting him, I'm again looking for symmetry of his feet and his toes. I'm looking for any obvious deformities. I'm looking for any rashes or swelling or anything that might be obvious. I'm then going to inspect his toes. So I'm going to start with his flagells, and I'm going to be palpating them to be checking for any crepitus, any swelling, any pain that he might have in his joints, his toes. And then I'm going to move on to the proximal flagells, and I'm going to be palpating for any pain, any crepitus he might have. And then I'm going to move on and I'm going to be checking for Morton's neuromas, which are usually found in between the second or the third and the fourth toes. And I'll be feeling for any pain that he might have in those, and I'll be just palpating his metatarsals. And so no Morton's neuroma, and then I'd be assessing for any, palpating for any plantar fasciitis. No. Any pain or tenderness with that? Perfect. So with his feet and his toes, I'm going to have him do a few range of motion. So I'm going to have you extend your toes, and then I'm going to have you flex your feet, and then I'm going to have curl your toes. Sorry. And then I'm going to have you invert your feet. Sorry, and invert your feet. Perfect. Was there any pain or tenderness with that? No. Okay. Next, we're going to move on to the ankles. Again, the ankles, starting with just inspecting his ankles. Again, looking for any deformities. I'm looking for any swelling that I might see. I'm looking for the symmetry of his ankles. Everything is symmetrical. There's no obvious deformities. So next I'm going to palpate. I'm going to palpate his medial and his lateral malleolus. So I'm going to start with his medial. And I'm looking for any pain, any crepitus, any swelling, any deformities he might have. And then I'm going to move on and I'm going to palpate his Achilles. And I'm looking for any crepitus, any pain, any tenderness he might have. And I'm going to start with, first I'm going to do passive range of motion. So I'm going to, first off, I'm going to grab your foot here, and I'm going to do dorsiflex, and I'm going to plantar flex, and I'm going to invert your foot and evert your foot. And then I'm going to have you do that for me. I'm going to have you dorsiflex, and I'm going to have you plantar flex, and then I'm going to have you invert and evert. Perfect. And then we're going to go ahead and we're going to move on to this foot and do the same. I'm going to do it for you first. I'm going to do a dorsiflex and plantar flex and invert and evert. And then I'm going to have you do that for me too. I'm going to have you dorsiflex, plantar flex, invert, and evert. Perfect. And I'm looking again for any pain, any tenderness, anything that you might have like that. And I'm actually going to have you rotate your ankles. Right. And I'm going to do it for you. There. And I'm going to have you do this foot. I'm going to have you rotate it for me too. Perfect. Was there any pain or tenderness with that? No. Okay. Next, we're going to move on to the knees while Matt's laying here on the table. With the knees, again, we're going to inspect. We're going to be looking for valgus and varus knees. So with valgus knee, it would be knock knees. Knees would be going in, and for varus, his knees would be going out. I'd also be inspecting for any obvious scars on his legs. I'd be looking at the symmetry. I'd be looking for any swelling, any tenderness, pain, red, or any rashes. And so the first thing that I would do is I would then palpate his suprapatellar pouch. And I'd start up here. Again, I'd be looking for any crepitus, any swelling, any tenderness. And as I'm doing the suprapatellar pouch, I'm going to go down the sides of the patella, palpating for any laxity in his knee, be looking for any crepitus, pain, swelling, suprapatellar pouch, down to the patellar, looking for any crepitus, any swelling, any deformities there might be. Just going to make sure my screen doesn't go off. Okay. And then I'm going to be looking for a Baker's cyst, and that's going to be and the popliteal fossa. And so that's going to be behind Matt's knee, and that would be a sign of trauma if there was any pouch back there. That would be like a pocket of fluid. Feeling back there for that too. Perfect. Any pain or tenderness with that?
No.
Okay. There's 4 tests with the knees. The first test that we're going to be doing is for the valgus. And the valgus is where I'm going to be abducting the leg, and I'll be testing the medial collateral ligament. So with my hand on the lateral side of Matt's leg and my hand on the medial side, I would be abducting the leg. Again, I'm testing the medial collateral ligament. And then I would do that over here on his other leg too. I would be having my hand on the lateral and my hand on the medial, and I would be abducting the leg, again, for the medial collateral ligament. And then we're going to go on to the varus, and the varus tests the lateral collateral ligament. It'd be laxity in there. So I'm going to start, and I'm going to go from the inside of Matt's leg, and I'm going to have my hand on the medial side, and I'm going to be holding the lateral side, and I'm going to be adducting the leg and looking for any laxity in the lateral collateral ligament. And I'm going to do it here on the other side. I have my hand on the medial side, my hand on the lateral, and I'm going to be adducting his leg, looking for laxity in the lateral collateral ligament. Next test is the Lachman's test. So with the Lachman's test, I'm going to be testing for tibial laxity, which is in the posterior and anterior cruciate ligaments. So for the Lachman's test, I would be testing the tibia for laxity, and I'd be pulling up on the tibia, looking for the tibia to have any laxity in it. There's no laxity in that. We're going to move on to this leg and test it. And again, I'm looking at the tibia for laxity in the anterior and posterior cruciate ligaments. For the drawer test, I would have Matt pull his leg up, and I would be sitting on Matt's leg again. I can't sit on this table. I'd sit on the table, and I would be pulling against tibia again, looking for laxity on anterior and posterior cruciate ligaments. So I'd be pulling on here, and I'd be looking for laxity in the tibia. And I would do it here on this leg. The drawers test, sitting on Matt's leg, pulling on the tibia, looking for laxity in the anterior or posterior cruciate ligaments. The next test is the McMurray's test. For McMurray's test, again, I'm looking for laxity or pain or crepitus. So I'm going to extend Matt's knee, and I would push the knee medially as I extended his leg, looking for laxity there. Again, I'd push it in, and I'd be extending his leg, looking for laxity in his anterior or posterior cruciate ligaments. And we'll do it here. Again, I'd push Matt's leg medially, and I'd be extending his leg. Perfect. Was there any pain or tenderness with that?
No.
Perfect. Next, we're going to move on to hips. Again, with hips, if I was in a clinic, I would have Matt in a gown so that I could assess and look at his hips. I'd be looking for symmetry. I'd be looking to see how he sat. I'd be looking at his posture, looking at his iliac crest. And so first I'm going to start with palpation. So for palpation, I'm going to start with his anterior superior iliac spine. And I would find that right here, his anterior superior iliac spine. And then next I would go on to his greater trochanter. And I'm feeling again for any pain, any swelling, any tenderness, any deformities, any nodules. And then I would move on to his posterior superior iliac spine. And then for his sacroiliac, sorry, maybe I'll have you sit up, sacroiliac joint. Maybe move just a little bit, sorry. Yeah, I'm gonna have you stand up so I can show your back. His sacroiliac joint is right here. Perfect. And why I have you sitting up, what I'm gonna have you do is do some range of motion. That might be easier for us. I'm gonna have you just turn. We're gonna do flexion. So I'm gonna have you kick your right leg out in front of you, and I'm gonna bring it back for extension. Sorry. Perfect. And then I'll have you do your left leg extension, or flexion, sorry, extension to the back. And then I'm gonna have you bring your leg out to the side for abduction, and then across your body for adduction. And then it's the same with your other one, with your left leg abduction and across your body for adduction. Perfect. And I'm gonna have you lay down. I'm gonna do some passive range of motion with you. Sorry. Perfect. I got you right there. Perfect. I'm going to have you bring your leg up, and then I'm going to, for passive, I'm going to do adduction, abduction, and then adduction. Perfect. And then I'm going to do it here to your other leg. I'm going to abduct, perfect, and then I'm going to adduct. Perfect. Was there any pain or tenderness with that?
No.
Great. There are two tests that we're going to do. The first test is a Thomas test. I'm going to have you, for the Thomas test, I'm going to have you bring your left leg all the way up to your chest here for me. Sorry. And this is just going to detect any flexion contractures in your hips. Perfect. Any pain with that?
No.
And then with your right leg, I'm going to have you do the same. Perfect. Any pain or tenderness with that? That's awesome. And then for the Patrick's test, I'm going to have you bring your left leg, and I'm going to have you just set it here on your thigh, just right across like that. And then we're going to just put a little pressure down on that. Let me know if there's any pain.
No.
Okay. And that's just looking for any joint disease in this sacroiliac joint. And I'm going to have you do the same here with this leg. And we're going to just push down, and if there's any pain again, there's
No.
Yep. Okay. All right. And then the next one is going to be the spine. So I'm going to have you stand up so I can do it for the spine. Sorry. Perfect. I'm actually going to have you turn to the side here, and I'm going to have you turn the side, because from the side I'm going to inspect your spine. And I'm just, from the side, I'm going to be looking for any cervical or lumbar lordosis, and that would be its way back. And then for looking at for kyphosis, which would be for dorsal kyphosis, which would be a humpback. So I'm going to have you turn to the side, and I'm going to inspect your shoulder height. And I'm looking at shoulder height. I'm looking to see how things sit symmetry-wise. I'm looking at his spine. I'm going to look at his iliac crest. And then in the clinic, I would have Matt with his gown off, so I would be looking at the creases under his bottom to see how they lined up, looking for symmetry of his hips, his legs, making sure one's not taller than the other. And then as Matt, as you slowly bend forward, I'm going to be looking and assessing your spine. And again, I'm just looking to see his range of motion to 90 degrees, which is normal, and looking at the the symmetry of him bending over and the easiness of him bending over. And I'm also assessing at this time for scoliosis. And Matt's spine is nice and straight, so I'm going to have you stand up nice and slow. I'm going to next palpate, and I'm going to palpate the spinous process and the intervertebral spaces. And I'm going to start at thoracic and work my way down to lumbar, since I've already assessed the cervical. So again, I'm going down each vertebrae, and I'm looking for any herniation. I'm looking for any changes in spine. Looking and feeling for any inflammation, any crepitus that there might be. I'm going all the way down. Let me just make sure this doesn't turn off. And I'm going to, with ulnars, parts of my hands, I'm going to be palpating down Matt's spine. Looking for any crepitus, any inflammation. It looks good. Was there any pain with that?
No.
All right. Next, I'm going to sit down, and I'm going to just assess your range of motion. So I'm going to have you first turn to left, and then I'm going to have you turn to right, and then I'm going to have you flex forward, and then I'm going to have you extend back. Perfect. Was there any pain or tenderness with that?
No.
Perfect. At this time, I'm also just really observing the fluidity of the motions, making sure there's no changes to a spine. And for the last test, I'm going to have you do the straight leg test. So once again, I'm sorry, I'm going to have you lay down. Yep. And I'm going to have you just raise your left foot all the way up. Perfect. And then I'm going to have you and slowly bring it down. And then I'm going to have you bring your right leg up and slowly raise it down. Perfect. And again, I'm just looking if there's any pain in Matt's lower back. It could be a sign of problems with his lower back. And thank you for viewing my video.